Hello, Gold participants from around the world. I'm Fleur Bickford, Program Director and MC of Gold Midwifery 2015. I'm chatting today with Dr. Barb Morrison about her upcoming presentation titled Breastfeeding, Only Nourishment or Part of a Larger Process. Welcome, Barb. Thank you for being here with us today.
It's great to be with you, and I'm looking forward to the full presentation.
Thank you. So, question for you, just to start a little bit of discussion about what people can expect with your presentation. What do you think is the biggest misconception that people have about breastfeeding?
I think the biggest misconception that most people have, and something that frustrates me a lot, is that we think a lot about breast milk and what it does for the infant, but we don't appreciate that what's also happening during breastfeeding is the touch and the connection, but eye connection and communication and things, and that in many respects our newborns need us, need our touch, need our holding, need our conversation as much as they need the breast milk for development. And so by holding them, in the research what we see is that IQ quotients are higher, their IQ scores are higher. And yes, there are a few things in the milk itself that will help with brain development, but I think a lot of that has much more to do with the amount of touch that our infants get when they're being held and being breastfed, and the fact that even breastfeeding itself is skin-to-skin contact.
Wonderful, thank you. Such important points. So, what do you hope people will take away from this presentation? What are you hoping that the healthcare professionals that are listening will be able to take away from the presentation and apply to their own practice?
I think my biggest takeaway is just the point that I just made, that touch and holding are exceedingly important. And in the first 4 to 6 weeks actually after birth, the more parents can do skin to skin, the better off they are helping their infants in development. And so not only do we need the first hour or the first 2 hours of skin to skin, but it needs to be encouraged as much as possible through the postpartum period, wherever that is happening, and then, as I say, on through 4 to 6 weeks, because this is really the setup for a child's whole life. And it's the best time for us to do hardwiring to those areas in the areas of the brain for social development, cognitive development, and emotional development, and any other development you want to think about. And it's our most opportune time. We can change some of it later, but the more we can put those hard wires down starting immediately after birth, the better off the infants will be.
Wonderful, thank you. I think it's such an important thing for us to be talking about, and it's interesting you talking about doing the skin to skin for sort of the first 4 to 6 weeks. I think often when we hear about skin to skin, the focus is typically on the first hour, and people often, I think, forget that skin to skin skin to skin contact is really important, even beyond that first hour. So really looking forward to hearing more about the research and learning more about how all of that works in your presentation. And I know that our delegates are too. So for our delegates, Barb will be presenting live for us on February 25th at 1700 UTC. So be sure to join us then. Thanks for listening.